Regional Urology. Why don't you tell us about when you started medicine and tell us a little bit about your career?
Well, I started medical school in 1971, finished in 75. I did 3 years with the U.S. Army, came back to LSU Shreveport, did my residency, finished there in 1982 in urology, went into practice at Urology Associates, which was on Greenwood Road, practiced there for about 18 years, and then a group of us here in Shreveport came together to form Regional Urology. There was 4 independent practices that chose to come together as one big practice to make what we have now today. And it allowed us to give better service to our patients and to have more options to take care of them.
What year was Regional Urology formed?
It was formed in 1999. We all got together, everybody borrowed money to buy the land here where this building is, and that's what brought us together, cohesiveness and debt, it binds you together. And then we started looking at architects who could design a building like this, and we visited a guy in Florida who liked the building that he had created, and he drew up the original plans for the office, and he told us to make it bigger than we did, but we were concerned. We didn't want to make it too big. And since that time, we've added on 3 times. We added addition to the building and then built the radiation center across the boulevard in the last 18 years.
So why did you choose to become a urologist?
Well, when I was in medical school, urology was the last thing I took my senior year. And I knew I wanted to do something in surgery, but I didn't want to do general surgery. And I did not want to do some of the other surgical subspecialties. So I took orthopedics, ear, nose, and throat, ophthalmology, and urology as my last choice, and urology is just what clicked for me. And I had a 2-year obligation. I knew that I wasn't going to be able to do a residency right away. So as it opened up, when I finished my 2 years of active duty as a flight surgeon, there was a spot here in Shreveport, and I came back and did my urology residency from 78 to 82 and joined Urology Associates.
So how long have you been in practice, and what has it meant to you to be a urologist here in Shreveport, Louisiana?
I've been in practice since 82, the first 18 years on Greenwood Road, and since here. And it's just been fun to do what we do. Urology is a very diagnostic specialty. It has surgery in it, it has medical issues. But it's in this specialty, it's easy to get the right diagnosis for patients. If you listen to what people tell you, that's the history. They're going to tell you what's wrong with them most of the time. And then you do the right physical exam, order a few blood tests. You don't have to order an exhaustive amount of tests, but then get the right imaging. And we've got great optics to look inside the urinary system now. And it really intrigued me, the accuracy of diagnosis that you can make in urology. And the surgery was straightforward and exciting to do, and it was a natural fit for me.
So, we see a lot of changes in medicine now. What advice do you have for doctors that are pursuing medicine in a ever-changing environment?
Well, one thing is certain about life and medicine and everything else, there's always going to be change. But like I've told a number of young physicians, I said, the disease process will never change. Your diagnosis will be the same. You're going to arrive at what you want to do for the patient by the same methods we've always used forever. History, physical, lab, test. What has changed is how we have to interact with patients to get things approved. There's a lot of third-party payments. Somebody else pays for healthcare now, and there's much more administrative things that have to be done in medicine to take care of the patients. But it's still, the disease process is still there, and I tell young doctors or people looking at medical school or whatever, if that intrigues you, trying to figure out what's wrong with a person, try to get them better, medicine is going to be a good fit for you. Just don't do it because of some expectations of just different things. You ought to do it for the joy of doing it first, and if you do it that reason, you're going to be happy. There's always going to be change, and there's going to be conflict, and there's going to be a lot of hurdles to cross over. But if you're doing it for the reason that what we just talked about, I think you're going to have a very satisfying practice life.
Lastly, you've been doing medicine for a long time. Obviously, you've seen a number of patients over the years. Do you have any thing that you want to leave as a parting gift or advice or thoughts for your patients?
Yes, I have enjoyed every patient that I see. I try to really spend time with them, so my patients know that I really care about them. And over the years, you know, a lot of these people that have had cancers or kidney stones or recurrent urinary tract infections or things like that, you see them once a year. And many times they bring their families with them, their wives, their significant others, sometimes even their kids. And so I've got to know an awful lot of people and their families. And, you know, over these years, they've not just patients, they've become friends. And it's been a lot of, it's kind of a lot of fun the last 4 or 5 months, because I've been telling people kind of what my retirement plans are. And it's kind of bittersweet, you know, it's been fun seeing them. But I'm going to miss seeing these people. There's no doubt about it, because a lot of, you know, you just get that attachment, you get that bond. You've got to care about them as a patient, a person, but then, you know, like they become your friend.